In this video, we are going to introduce how to use Fibularis Tertius, FT, tendon for V-shaped double bundle anatomical anterior talofibular ligament, ATFL, reconstruction. Declaration: all authors, Mengjun Ma, Hantingyi, Biayan, Hongyu Li, Ishuan Lu, Shizhu Sun, Rao Fu, Wento Zhang, declare that they have no conflict of interest. Here we can see the FT tendon on the gross specimen, which is located in the superficial region of the anterolateral leg and is adjacent to where the ATFL is located. Both ends of the FT were marked with blue pigment, and the length of FT was approximately 10 centimeters. The patient with left foot injured is placed in the supine position. Following successful general anesthesia, the affected hip is moderately elevated with a cushion, maintaining slight internal rotation of the affected limb to expose the lateral aspect of the ankle for subsequent reconstructive procedure. The drawer test on the affected ankle is positive. Below the incision, the FT tendon is exposed at the lateral side of extensor digitorum longus, EDC. When the FT tendon is retracted, the toes don't extend. But the EDC tendon can be identified for differentiation as it could extend the toes and assist in dorsiflexion. A tendon extraction device is used to engage the FT tendon, first pushing it proximally to free it from the muscle, and then retracting it to the distal end, which can be observed inserting at the distal base of the fifth metatarsal. A small skin incision is cut above the tip of the passer, just distal to the base of the fifth metatarsal. Push the device distally to free it from the muscle. The tendinous part is then woven into a tendon bundle with a diameter of 3 mm and a length of approximately 3 cm, with a traction suture left at the end for later use. An approximately 2 cm incision is made in an arc just anterior and inferior to the tip of the fibula. A bone tunnel is drilled through the talar neck surface at the ATFL insertion site toward the distal end of the medial malleolus. A 2.7 mm all-suture anchor, Rejoin Medical Company, Hangzhou, China, is then inserted into the talar tunnel in order to secure the midpoint of the tendon. The ATFL insertion site on the fibula is freshened. 2 fibular bone tunnels are then drilled through this area using a cannulated drill, oriented along the course of the ligament at 30 degrees in the coronal plane and 45 degrees in the sagittal plane. The diameters of the superior and inferior tunnels are approximately 3 mm, corresponding to the dimensions of the screw body. Tightly suture the midpoint of the woven tendon graft to the suture tails of the internal row anchor in the talus. 2 3 mm external row anchors are then inserted through the fibular tunnels to secure the graft and reconstruct the superior and inferior bundle insertion sites on the fibula. Additional reinforcement sutures were placed with the ankle in mild plantar flexion and eversion, creating an angle of approximately 10 to 15 degrees between the two reconstructed ligament groups.